Dr. Harris served with the CDC for 20 years. He was leading their work with employers and health plans. He consults with Fortune 500 companies, has authored over 80 journal articles, recently received the Distinguished Service Medal from the U.S. Public Health Service for work in prevention. But what have you done for us? He is the director of the University of Washington Health Promotion Research Center, and they're the ones doing the evaluation for Washington Wellness and HWI. That's Lydia. And he's currently focusing on practical steps employers can take to improve employee health and productivity. I really view Jeff as a mentor for all of us.
Thank you very much. You know, I'm a parent of a 14-year-old, and I don't know how many of you who have raised teenagers, but it's a mixed blessing. One of the things that's fun about it is you get to hear these conversations. I mean, you hear this all during childhood, but they're always interesting. So about 2 weeks ago, I was taking my son and a friend of his to a concert, and the other kid went to another school. And my son, for reasons I'll never understand, said, "Do you guys like have fashion fads at your school?" And I said, and the other kid said, "No, we don't have fashion fads. I mean, like sometimes, a dude will like go and buy something new, and none of the rest of us have it, and we look at it and we think it's cool, and then we all go and buy it. but we don't have fashion fads." And so the point of this story is that we are normative individuals. We are driven by social norms. We are driven by fads. Not all of us and certainly not all of us on everything. And this is really important, and it's something that we can use in the work that we're doing when we try to promote healthier behaviors among our employees. But I also think it's something that we should be cautious about when we look at what's being done in workplace health promotion. And especially when you're looking strategically. I mean, I think we should certainly be learning from each other, and certainly tactics, and that's what a lot of today is about. And we're looking at the big picture and strategic things we want to do. I think we want to be careful to say, what's the science behind this? And also, what's the logic behind this? And think about those things carefully before we embark on things. So my goal, as much as anything today, is to share a framework with you that is science-based, but that hopefully is easy for you to use. That's make it easy for your employees to have healthier behaviors by removing the barriers. Make it popular for them to do so. That's the normative fad thing. And show them how by giving them practical skills. With all of this, especially after that very nice introduction, I do want to express some humility. You guys are all experts. You've been in the middle of this, and we'll see whether you have anything to learn from me. I certainly have a lot to learn from you, and I've enjoyed even hearing the parts that I've heard so far. So let's go and embark on this. I'm going to quickly cover just a couple things to make sure we're on the same page, why chronic diseases are so important, and what the behaviors are that we want to see. And then most of the time we'll spend talking about what we as leaders of this effort can do to help our employees have healthier behaviors. So these are actually the top killers for people in Washington State. These are people of working age, 18 to 64. And there are no surprises here. I still haven't figured out how to get PowerPoint to make some things one color and other things another. Although I spent quite a bit of time on it again last night. So if you look at this list, you've got cancer and heart disease and diabetes and chronic lung disease and stroke, which I think everybody would count among the kinds of chronic diseases that we want to prevent. And you see that they add up to about 60% of deaths in people in this age group in Washington State. So it's those big five that we want to work on. And, no real big secrets about why we want to work on those things. For one, we want to work on it because of the healthcare costs. I mean, I think that's what got our bosses to focus on this. But Ron Getzel's work shows that healthcare costs are only about half of the way that these killers end up costing us. they also cost us really heavily through turnover. You know, we are, particularly in a place, in the kind of work that you do, we have a pretty highly skilled workforce. And when people become so sick that they can't work anymore, or they become so sick that they die, it's really expensive, actually, to replace them. We've got all those recruiting costs, we've got training costs. You know, one estimate is it's about a year's wages to replace an employee. And it really is expensive. Obviously, absenteeism is a problem, about 8% on this. Disability in the HR sense, both short-term and long-term disability, when people don't come to work because they're ill before they quit work entirely. And then workers' comp costs are about twice as high in people who have chronic diseases as among those who don't, here in Washington State. Of course, what's not shown on this is what I'm sure you've thought and talked a lot about, which is presenteeism, which is people being at work but not really being as effective as they could be because they're ill. And the estimates are, you know, I don't think this is a completely exact science yet, but the estimates are that we're talking between 1 and 4 times healthcare costs for presenteeism losses. And I think that's about what IHPM says. So if those are the chronic diseases and their problems, you know, what are the behaviors we want to see? I know you know all this, but let's just go over it briefly. 3 lifestyle behaviors, and then I'll talk about clinical behaviors in a minute. I like to separate them because they're different. I mean, we can work on both of these in the workplace, and we should work on both of them in the workplace, but a lot of the clinical stuff has to happen in clinical settings. But the lifestyle stuff is things that people do on their own without the help of a clinical person, a doctor, nurse, whatever. And the big 3, avoiding or stopping tobacco use. Amazingly, still 1 in 5 deaths in this country, over 400,000 dead people a year. You know, lifetime costs are $9,000 or $10,000 per person higher for healthcare costs if they're smokers than for non-smokers. So it's a big deal. Being physically active, you know, if I could wave a wand and do one thing, you know, there is no fountain of youth, there is no magic bullet, but boy, if there were one that I would pick, it would be physical activity. Because it can decrease heart disease and cancer, it can make us less depressed, it can make us less stressed. I mean, it's a wonderful thing, and you'll see that we aren't doing so well. And then needing to maintain a healthy weight. I listen to books when I drive. I happen to start The Omnivore's Dilemma. Don't ask me why I waited so long driving down here today. And you know, the fads, I mean, is it carbs or is it fats or whatever, which is the demon food of the week. There's a lot of controversy about eating. But what's clear, everybody agrees that we eat too many calories as a nation. And so I think we can all get behind this notion that whatever else we might want to tell people, we need to tell people to eat enough to maintain, or a little enough to maintain a healthy weight. Clinical behaviors, and the big 4 for chronic disease. You may be surprised to see flu on this list. Flu vaccination. What does that have to do with chronic disease? Well, about 5 years ago, CDC doubled their estimate of the number of flu deaths in this country each year. And the reason they did that is they actually did an analysis that showed that about half they showed that there was a huge number of deaths, about 20,000 a year, heart disease deaths that were related to flu. So people get flu, they get a little bit dehydrated, their blood thickens, they have heart attacks, or their congestive heart failure worsens, and they end up, you know, either in emergency rooms or hospitals or dead. So that's why flu. Screening for cancer, breast, cervical, and colon. Notice prostate's not on this list. I mean, if you want, we can argue about that. I'd rather not. But breast and cervical and colon are the only 3 cancers that everybody agrees we ought to be screening for. Screening for hypertension and lipids, which I'll talk about more later on. Not nearly as important, actually, frankly, as the thing after that, which is we do a good job of screening for hypertension and lipids at about the 95% level. Last time we looked in Washington State, screening for hypertension, and about the 85% level screening for lipids. We do a terrible job of treating people for these diseases, less than a third for each of these diseases. And we don't do as well as we could and should for diabetes either. And part of the solution to that, I mean, I'm not I did train as an internist, but I don't think of myself as a pill pusher. But in the case of people who have these chronic illnesses, most of them need to take medications, and most of our job, a big part of our job, is to help them actually get access and take those medications. for hypertension, diabetes, and lipids.